This story is about overcoming fear and an inability to conquer problems. It could be your story too. This film has been made to help everyone who finds difficulty in winning through when the going gets tough or the unexpected throws you off course. Through a specific set of circumstances that we recorded quite unexpectedly, we can show you the shock of a car accident on the way to a driving test and how the driver was helped to deal with the resulting trauma and carry on. The technique used has helped many people, and this story will show you how.
Hi, my name is Monica D'Agata. I'm a grade 6 driving coach. I work in the areas of London and Kent, helping people to learn to drive, as well as overcome fears of many things, among them fear of a driving test, using a technique called thought field therapy, or TFT for short.
Driving without fear. TFT in action.
TFT is a therapeutic technique that was discovered and developed by Roger Callahan, an American psychologist, back in the 80s. It helps people overcome phobias, fears and anxieties, and it's achieved by tapping on meridian points in a particular sequence. What you're about to see in this film is how effective TFT is in action. Recently, my student Adriana and I were on the way to a driving test when another vehicle crashed to the back of us just 20 minutes prior to the test. But by using TFT, I was able to alleviate her trauma of the accident and her fear of the driving test.
The CCTV camera recording inside the car will show us exactly what happened that day. But before we see the incident with TFT in action, we need to first be familiar with how it works. Here is Ildika Skur, TFT DX Advanced Trainer and Practitioner, to show us how the process actually works.
So I need you to think about something in the past that's happened to you that you want to let go of. It still upsets you. And you don't need to tell me what that is in detail, okay? So can you bring something to mind? Okay. So on a scale of 1 to 10, 1 being it doesn't upset you at all, and 10 being the level is as high as it could be, right now thinking about it, where would you grade that emotion?
7.
7. Okay, so that's our starting point. Now I'm going to ask you to keep thinking about that problem, that emotion, and I'm going to take you through a tapping sequence, and then I'm going to stop and check whether where your level is again, okay? Alright, so first of all, I want you to just tap the inside corner of your eyebrows, both sides, that's it. Tap about an inch under your eyes. Tap under your arm, one side, that's it. And then with your palm open, tap your collarbone either side. Then tap the inside corner of your little fingernail and tap your collarbone again. That's it. Okay, and just stop. Forget what we've just done. Take yourself back to the thought and the emotion and tell me where that is now on a scale of 1 to 10. Is it the same or different?
Same.
It's the same. Okay. So in that case, I want you to tap the side of your hand here a few times, just thinking about that emotion. And then tap again, eyebrows, under the eyes, under the arm, and the collarbone, the little fingernail, and the collarbone again. That's it. Okay, and just stop. Take yourself back to the thought and the emotion. Does it feel the same or different?
Different.
Okay, what figure would you put on it now?
6.
Okay.
Now let's return to the incident in which Monica and her pupil Adriana were involved.
Do that just in case, because paintwork on the face is not unnecessary. My paintwork don't. Oh my god, this is the thing I'm petrified of. Driving down here. Bring the clutch up so you have engine braking. That's it. I need to take a deep breath, seriously.
See how, look at yourself, see how calm and collected you are here.
I'm alright here, I think.
It's not where I can go. Yes, you can.
How do you feel seeing it now? Knowing that in the next 3 minutes...
No, actually, I can't believe it. I was that calm doing all of this, driving like that.
And this is on the way to the test, so
You know, for someone who is about to have a test, I was actually alright.
Yeah.
But Adriana's calmness was to be shattered as an accident occurred a moment later.
We're on the wrong street? Go? What have I done? You stopped. How I can do this?
Adriana was in shock, but Monica had to first leave the car to deal with the situation on the road.
What the
I was in shock, I think, you see.
f***?
Do you recall
I don't want to do my test.
I'm not sure I actually was aware what just went on.
He was the blind.
Yeah.
He went straight to you on a red light. You're a witness. And he went, you can have a police. You are a witness.
What's
I
wrong?
am in shock.
Oh. Hold on.
I remember I had a pain straight away and I was like...
Clearly in a bad state, Adriana was abandoning all thoughts of continuing with the test. It is an understandable reaction, but one we generally don't have the tools to deal with. However, experts can analyse both the circumstances and how to cope with this type of situation.
You can see that I'm looking at the pedestrian, and that's the impact. Now obviously she's swearing now because it's literally split seconds. So when you see the footage of the pedestrian who is standing there now, you can see that he's approaching the crossing in such a rapid way that she doesn't have a choice. She's not. She doesn't have a choice. I say go because I see him rapidly stopping, but for her, the reaction is already there. She's already going for the brakes. Now the driver behind isn't looking at anything but the road ahead. He doesn't analyze, he doesn't scan, he's too close. And because of that, he doesn't got time to react. He goes into the back of us. As simple as that.
Adriana makes her own assessment of her responses and feelings at the time and their effect on
Yeah,
her.
I remember that bit. I was terrified, seriously. I think I started saying, it's my fault, or something like that. I remember saying things like that. And I don't think I actually know what to do with myself.
Do you recall what you were thinking at the time?
I was terrified. You know, that time the only thing was on my mind is like, did I damage your car or something like that? Very badly, or it's just like...
Were you thinking that there was something, that you have done something?
Yeah, I thought it's my fault.
Why?
Because you know, especially when I think this bit is not in a film, but I remember when you said to me, why did you stop? Do you remember that bit?
No, it's all in the film.
And
I
after
did.
that- and I think when
I
you said
go,
that,
I didn't say why
oh
did you
yeah,
stop?
go. I think after that, I think that it must be my fault because you're saying to me go and I stop, so it's definitely my fault.
You don't say anything now, okay? Stop here. Please. Secure the car. Engine on. That's not your car. Did I?
I'm really in shock. I think I'm crying now. I remember crying actually.
Why were you crying?
You know,
For most people, this traumatic situation would mean the end of the day's activity and any prospect of taking the test.
Do you recall that part there, when you were leaning over the steering
yeah,
wheel?
I remember that bit, yeah.
Do you recall what was going through your mind?
No, really.
On the very next clip, you can see how traumatized she becomes, because simply I have to deal with the situation. So I need to prioritize and deal with what's going on. I need to deal with the car. I know if I move the car too far, then I won't have the evidence for the insurance company. And so first thing I have to do is get out and take pictures. Once I take the pictures, I have to deal with the driver because we have to move from the scene because we're causing an obstruction. And then I'll obviously speaking to the witness, who is the pedestrian, who tells me that he doesn't drive because he's afraid, he was always afraid to drive. So his actions are directly relating to his lack of knowledge of what's going on. He doesn't know what effect he's going to have on the young driver approaching, or any driver approaching a crossing at that speed. And she can't make that decision whether to stop or go because he's too fast. I'm sure he will change his mind now.
Ildiko discovered the way TFT can help from her own experience of a quite unexpected driving incident she witnessed and the serious effect it can have on someone's feelings. She realised how the traumatic reaction can be treated and the very real benefits to be gained.
I've actually used TFT with somebody to get them over a driving issue. It wasn't actually a client, it wasn't a booked client, it was somebody who I just actually met on the street. I was going somewhere with a friend and our destination was a car park, and when we arrived there was this enormous Arctic lorry blocking the entrance into the car park. So I said to my friend, right, hold on a moment, I'm just going to go and check what's going on. And I went over to the Arctic lorry, to the cab, and there was this enormous lorry driver getting out of the cab, and he was shaking from head to foot. And he was finding it hard to actually come down the stairs because his legs were like jelly. I could see he was just absolutely in a real state. And when he got out of the cab, I asked him if he was okay, and he said, "Oh my God," he said, "I've just run over a boy on a bike." And he just looked sheet white. He was really in a state. And I said, "Is the boy okay?" And he said, "Well, yes, the boy's okay, but his bicycle is just totaled. It's a wreck because the lorry hit it and it just disintegrated effectively, twisted metal." And it was the image of the twisted metal that made him think of what could have happened, the fact that he could have run this boy over. And he was in such a state. And I just said to him, "Right, I've got something that I can help you with straight away to feel better." And I just got him to concentrate on what I was doing. I tapped through a specific sequence for trauma, and within less than 2 minutes the shaking had stopped, and in a couple of minutes he was back to normal and he was totally calm and fine. Now, the thing is, if we had allowed him to carry on with his journey without treating him for that trauma, he may very well have ended up creating a much bigger accident, maybe on the motorway now.
I actually call it the emotion aspirin that should be available in every medicine cabinet in every home.
Absolutely,
because it's invasive, and once you know how to tap, you can get rid of lots of different issues that you might have that stop you from functioning on a day-to-day.
That's right.
It's helped me tremendously, so that's why I feel that without it, my life wouldn't be as it is today.
So how did Adriana benefit from TFT in her own traumatic situation? She had been introduced to the idea of thought field therapy earlier by Monica to address other personal fears.
I told you about that. I got fear of water, and you used TFT on me, and from now on I'm alright. I don't have problem. I even want to learn to swim.
After the incident, when the immediate issues at the scene had been dealt with, Monica used TFT with Adriana again.
The second time, I think, was after my accident. This was the second time when we used TFT.
After the initial TFT in the car with tapping, Adriana undertook herself. Monica took her back on the road with further therapy to overcome her negative feelings.
I need to be in charge of the situation because there are other things that need to be done first. Because I need to give them my undivided attention. I can't start and then move off somewhere else and finish them off, and then I need to finalise those things and then 100% attention on her. So then, once I've shown her that, she sits tapping
Right.
on her eyebrow until I finish. It's surprisingly that it's minutes, literally minutes from the crash.
Yeah.
Okay, tap here again. Tap. No, please tap.
And this exactly shows that the TFT itself, it doesn't necessarily mean that if you were at fault in an incident, you're not going to be able to help yourself, or you're not going to eradicate the trauma that you put yourself under. Even though you might cause an incident, it happens that TFT will alleviate your emotional pain, because simply you can't do anything about it anymore. So you have to get on with what's happened and deal with it in a rational kind of way. And that's what TFT will help people with, or it helps them with. And how did you feel before and after? Just, we've watched the footage now, recalling the emotions and feelings that you went through.
And before I feel horrible, and I was blaming myself for the accident and keep saying I don't want to go and have a test and things like that. But after the TFT, I was alright. I didn't have any problem. I was confident I can go and do
And
the
how
test.
did you feel? Were you petrified of the crash? Were you thinking of the crash at all?
No, I didn't even think for 1 minute when I went to the test. I just a couple of minutes ago I have an accident.
Okay.
It didn't take long before Adriana was ready to take the test after the help from TFT, and was even enthusiastic to do so.
See, I said that I start saying,
Documents.
"Get my documents." I didn't even think that. I didn't even think that I had an accident. It's really helped.
And I'm reversing back into the bay.
And
And
it's me.
Look at yourself. Marched off.
Yeah, I like don't have stress anymore.
Easy, huh?
It's actually very good.
So, as a practitioner, how would you describe what's actually occurred here? What has happened? What have I done? And what's the reaction? What's the reason for all of that?
Okay, well, Monica, what this footage shows is a very usual reaction to thought field therapy. It happens fast, and it's almost like it erases the memory of what just actually took place. You can see that your driver has had an enormous shock, which most people would sit there and, worry about, and in fact it would affect the rest of their day. Right? They would go into work and they'd be sitting there with their head in their hands, feeling guilty, feeling upset about what happened, and then of course the nerves about what the insurance company is going to say to them. They're going to get this phone call. All of that, what unpacks after an accident like that. And you can clearly see that after you actually did the thought field therapy with your driver, it's almost like it's just wiped it from her memory, and within 10 minutes, I think 10, 20 minutes, she's confidently grabbing that paperwork and she's marching off to the test centre to do her test.
Yeah.
I mean, where do you see that kind of behaviour?
The traumatic event is the test in itself for most people.
That's right.
And so many people can relate to that.
Yeah,
It's
exactly.
a panic and
Yeah.
sometimes real trauma, the test itself. And here we have a crash.
That's right, exactly. So you can see the power of thought field therapy working in a real situation with a real person having had that shock and then just being over it very, very rapidly. And this is very, very usual for somebody who has had thought field therapy. I mean, most of the time, if somebody comes, it would be a client in a therapeutic situation where something has happened a day before or a week before or perhaps several years before that we're actually treating. But it just shows that it doesn't have to be in a therapeutic situation. You can actually use it straight away.
Here and now.
You know, I mean, I mentioned about the lorry driver, but here it shows very clearly how you got her over that trauma, which for anybody else would have stopped them even going to the test centre. I mean, it was obvious that she didn't want to go before you actually did the thoughtful therapy with her. So it totally cleared that, and it enabled her to go and do that test rather than wasting money, wasting time, having to book it for another day. So yeah, it's a very, very powerful treatment.
Adriana can really see the benefits too.
If I was now to take you to the driving test centre,
Yeah.
would you go for a test?
Yeah.
Why do you think the incident happened? The crash? Who truly was at fault there?
Okay, now when I watch this, it wasn't my fault.
You see? So as you can see, despite the crash and the test nerves, Adriana leaves the car confidently and makes her way to the test centre, which would be unimaginable if thoughtful therapy was not used. TFT, however, is not limited to driving. It can be used to alleviate any negative emotions. Do you think TFT could help you live a life free of trauma, fears, phobias and anxieties?
If you would like more information about TFT or to experience the benefits of it yourself, you can contact firstlondondrivingacademy.com.